and Dr. José Cavazos. So for myself, I love public health. I've been in public health for many years. I've been in 5 academic universities and 2 schools of public health in Texas. I was in the School of Public Health in Fort Worth, and then I was also in the School of Public Health serving as the regional dean in the UT Health Science Center in Houston with El Paso Regional Campus. So my excitement is in public health, and I'll tell you a little bit about that. But let me introduce you to Dr. Christina Hernandez. She has been a registered nurse for over 33 years. She has earned her master's in public health nursing from the University of Illinois at Chicago and her PhD from the University of North Carolina at Greensboro. Dr. Hernandez has been teaching nursing for the past 11 years and currently teaches in the graduate and undergraduate nursing program to the university at the program at the University of Incarnate in San Antonio. Her passions include educating the first generation college students in nursing and learning students to provide care for vulnerable populations. So she'll be the second speaker after me, and I'd like to welcome Dr. Christina Hernandez. We also have Dr. José Cavazos. He serves as the Assistant Dean of the South Texas Medical Scientist Training Program. He's a professor of neurology. His education is very vast. He has a certificate in Business of Health, University of Texas, San Antonio, a PhD in Neuroscience from the University of Wisconsin at Madison, and also an MD degree from the Instituto Tecnológico de Estudios Superiores de Monterrey. He has vast experience as a scientist, a clinician, so I'm delighted to have him as well. Please welcome Dr. José Cavazos. So now I'm going to tell you a little bit about public health so that you see and explore that opportunity, whether you really like to see that as a health career. Well, one thing that one can say about how to choose a career is, well, in public health, you can think about, do I like the public and do I like the health? So that's kind of an idea of public health. Public health is going to encompass a lot of things about people, and specifically their health-related characteristics of people in many, many ways. That's what I liked about public health, that is so vast, that can give me opportunities. And one way to understand if you really like public health is to think about the 4 domains that the public health represent, even with the courses that you may get in a master's in public health, about statistics, about epidemiology, the statistics we know of COVID, the statistics about whether there is a percentage, a prevalence of a condition in a population. We know that the epidemiology relates to the tracing of diseases. Some diseases may have its causes in one major genetic factor. Others may be multi-causal, may be related to a variety of factors. So statistics and epidemiology are domains in public health that are there to try to aid in the understanding of health and wellness. We also have policy. If you like policy, if you like any policy related to health, that gives you the opportunity to think, oh, well, maybe I can be associated with policies on how best to do contract tracing for the COVID-19. Maybe I like policies to best understand housing that affects the well-being of people. Maybe I like policies about food deserts and how do I address the problems of food deserts. Or I like to have policies related to the environment and how do we protect the environment. And talking about the environment, that's another major field. If you like anything to do with the environment that affects health, it's about public health. So it's exciting to see that you could have many, many areas of the environment that public health really talks about in some way. And then the last one is about behavior. We know that our behavior affects our health. Anything to do with behavior and factors that affect our behavior are going to be associated with public health. So there is a lot of vast elements of thinking whether you like some of those areas. And finally, I'd like to tell you how you're going to get there. I think they're gonna get there is, I invite you to be as part of a journey. You need to know all about public health and the careers in public health, and knowledge is a gift. Think about all the different programs in the country that have public health. Study them, examine them carefully, so that you can begin to see what is the kinds of programs and what do they offer, a master's, a PhD. Talk to the professors, learn about it, so that you can begin to start thinking, what are the requirements of public health? How do we begin to start thinking about the way that we register into the system of SOFAs, for example, and how can I begin to start really saying, is public health for me? And so if that's for you, then you can begin to start thinking about your intentionality, that intentionality that is going to give you that capacity for making it real for you. And I invite you to start thinking about it in that way to make it very real for you. So now I'm going to let Dr. Christina Hernandez to talk a little bit about nursing and the field of nursing. Dr. Hernandez.
Okay, there we go. Thank you guys for your patience. Thank you, Dr. Balcazar, for your introduction. And I will say that public health is near and dear to my heart. I am a nurse, and my specialty is public health nursing. So you can certainly combine those fields. And for me, public health is where it's at for me, because I think of public health as health that every person and every population in this country needs to stay healthy. So I don't know if maybe Mr. Milano can tell me, do the slides appear to the students, or do I need to pull them up, or you've got them coming? Okay, great. Thank you, guys. So if you're interested in nursing, your field is endless and your job possibilities are endless. But you need to have your path mapped out well so that you don't waste extra time in school, extra money taking classes either you don't need or classes you would need to get in. So I'd like to streamline you through that. If we could go to the next slide, please. Unless maybe I can do that. Okay, thank you. Okay, so one of the things in nursing, our reports are really good as far as we still are in a shortage, and it's continuing to spread. And you'll see that the second fact I have down there is that there are 175,900 openings for RNs each year through 2029. Of course, you hear on the news now that nurses are absolutely essential, along with our physicians, our respiratory therapists, and our public health people to really meet the needs of what's going on. So any field you've ever thought about in nursing, you can do that, and you can have a great impact on what's going on in the world. Next. The next slide that you'll see, it talks about what you need to do. If you're interested in a graduate degree in nursing, you have to have your Bachelor of Science in Nursing first. So whether you are a freshman or a sophomore right now, generally most four-year programs to get the bachelor's degree, some of them will admit you straight into their Bachelor's of Nursing program. Others will have you do all your prerequisites and then admit you for the last 2 years where you get your bachelor's. You can certainly do that at a local college and transfer in. Local colleges are now, or community colleges are now having some authority to offer Bachelor's of Sciences in Nursing, but that's what you're going to need. There's a few other caveats that if you have individual questions, I can explain to you. From there, when you get your four-year degree, that's where you can start thinking about what would I like to do with a graduate degree in nursing. There are several paths. The main three there is your Bachelor of Science in Nursing to your Doctoral of Nursing Practice degree. There are many programs now that skip the master's point and go straight from your bachelor's to your doctoral nursing practice. So that's one option for you. Another option, the option that I was in, because the doctor of nursing practice degree didn't exist, I graduated undergrad in 1987. I went and got my master's, and I chose to specialize in public health nursing. Once you get your master's degree, you can either go on for your further degree, or what we call the terminal degree, your highest degree in the field, or you can certainly work wonderfully with your master's degree. The other option is to get your PhD, and that's what I have. And there are some programs now that will do BSN to PhD, so you don't necessarily have to go that route of getting your master's. This is for people who are focused and they know what it is and where they want to go. Next slide, please. I can tell you a little bit about what it is you're going to do. So with your master's degree, you're going to be able to get into an area of specialization. One of them is the nurse practitioner, where you are going to be in the clinical arena treating patients. Now, this is moving more and more towards a doctoral level of entry. So you're going to find a combination of programs across the country. Some will require doctoral level, and some will still allow you to do nurse practitioner with a master's degree. You'll have to look at the individual programs, your individual goals, and decide what best meets your needs. There are two other areas in your master's. You can become a clinical nurse leader or a clinical nurse specialist. If you're interested in these, really look at them. Look at the programs that offer them and decide what your goals are. What is it that you want to be doing when you graduate? We're seeing hospitals in certain markets. Where I am in Texas, we're not seeing hospitals hire as many CNLs or CNSs. That market has gone down. Maybe where you live, there is a market for it. But look at it and think about it. Be strategic. You want to make sure that you, for all the work, the time, the money, the effort you put in, that you have the career that you want out of this. Next slide. The BSN to DNP, this will prepare you for a couple of things. This could get you to your advanced practice registered nurse, okay, at the highest level. There are 4 categories of that, as you can see here. Your certified nurse midwife, a certified registered nurse anesthetist, and by the way, by 2025, that is going to be the only way to get your nurse anesthetist is at the DNP level. It will no longer be allowed at the master's level. You can become a clinical nurse specialist, or something that many of you may be interested is the nurse practitioner, which is that clinical arena there. On the right side of the slide, you'll see all the areas that you could specialize in as a nurse practitioner. Now, you can still do this at the master's levels at many universities. So you need to look and see what's offered and what are your career goals. I taught at University of Illinois for quite a while, and our thought was nurses are getting such an advanced education to become nurse practitioners. They are really doing work at the level of the doctoral level. So we wanted to have a degree commensurate with the amount of work that you do to become this nurse practitioner. So think about that and think about what it is that you want to do. Next slide. The PhD in nursing, that's the route I chose. And you need to think about this. If you're really thinking about a terminal degree, I chose not to do the DNP level because I did not want to go the nurse practitioner route. It was just my career preference and what I wanted to do. I was interested in getting further into research and teaching. And so I felt my area of specialty is health disparities. And I felt that a PhD degree in nursing was going to give me that richness for what I need and for what I do. So I have all my specialization is in that area. I could not go and treat a patient as a nurse practitioner does. That's not in my scope of practice. I can certainly work in the hospital or any outpatient setting if I would like to. I used to teach and work in the hospital or work in outpatient psychiatric. I've gotten too old for that. I stick with one job now, and it's a full-time job with my teaching at Incarnate Word. Now, this was a very quick overview. Again, my main point is think about where you want to be, because all of these programs have requirements that you must meet before you can be admitted. What I've given you here in the link is, if you're well, where are these programs? What can I do? Click on this link of AACN Nursing. That will take you to every accredited program in the country at a bachelor's level, a master's level, or a doctoral, meaning DNP or PhD level. If you know that you're geographically located in a state or something and that you want to look at the programs in Massachusetts, That would be the best way to do that and to find that out. And then to see what that school's requirements are and what they have so you can match your needs. I'd be happy to take any questions at the end, but I believe that we have Dr. Cavazo now who has more information for you about other areas you can advance in. Thank you.
Thank you. Can you place my slides, please? Thank you. My name is José Cavazos. I'm a physician scientist in epilepsy and the director of the South Texas Medical Scientist Training Program. That is a MD PhD program. Please, next slide. We are, next slide, the most diverse program in MSTP in the United States. Next slide. So what are MD PhD professionals? So we go to school, and next slide, it's a series of bullet points. We are fascinated by science and human biology. We work as physicians, we work as scientists, and we work in the intersect. Next slide. It's a series of bullet points. Have an aptitude for science and naturally curious about how things work in the human body. Most people are very creative and they are able to apply this information into biomedical research and also love teaching and medical students and other professionals. Next slide. Next slide, please. Next slide. So the MD, so there are multiple ways to become a physician scientist. MDs take 4 years of medical school, and during medical school they have opportunities to do some medical research, biomedical research during their training. In general, of all physicians, about 3% of them, only 3%, are ending up doing research as a primary focus, and less than 1% are NIH R01 funded. Next slide. An alternative path to do biomedical research as an important aspect in your career is to earn a PhD. A PhD is to be really fully immersed into biomedical research. Having said that, many of these individuals end up working as scientific writings, patent law, and many other activities. So if you look at them 10 years later, what is the outcome of these individuals? Only 22% of them are affiliated with a medical school and doing biomedical research, and only 18% of them are doing NIH R01 funding, which is the independent NIH research mechanism. Next slide. Alternatively, MD PhDs are learning to do both of these degrees. You need to achieve competency, but the difference is that during this training, we are paying you a stipend of $30,000 or so, plus we are paying you for your tuition and fees, health insurance. So it is a program that is fully funded. It is long, 7 to 9 years. After that, you pursue then typically a research-focused residency where you are going to be paid about $60,000, and then eventually you become a faculty member where you are well compensated, doing what you love, and you advance biomedical research. Now, 80% of MD PhD graduates end up doing research as a significant portion of their careers, and 43% of them are NIH funded, with 53% of graduates doing more than 50% research. Next slide. So there are about 110 programs across the nation, and as I indicated, we offer a stipend, tuition, and fees throughout this entire length of training. Next slide. Next slide, please. So what kind of research people do? Well, we do all kinds of a spectrum of research, doing basic research, translational research, clinically oriented research, healthcare outcome research, and other types. Next slide. So if you examine, for example, what people do in terms of effort, and you put the effort in the vertical axis, that's 100%. What you see in blue is the extent of what many of our graduates are doing. So about 20% of people are doing more than 80% research. About 50% of people are doing more than 50% research among their time. And certainly the clinical aspect, we are also physicians in one particular specialty. As I indicated, in my particular area, next slide, I am a physician scientist in epilepsy. And in my career, I have been doing research throughout the entire spectrum, all the way from basic mechanisms of how epilepsy happens in humans and experimental animals, done clinical observations, clinical trials, being the principal investigator of registration trials, done healthcare outcome studies, trying to understand whether a particular hypothesis is correct, a particular way of taking care of patients is best. And I have also been an entrepreneur and been able to get an idea to all the market through the FDA with registration trials and FDA cleared de novo approvals. Next slide. Now, so how do you apply? What is a successful applicant? So it does require strong academics, but many life experiences. It requires your MD component, meaning experience in caring for others, having some volunteering, some hospital experiences, having a high degree of integrity and maturity, but very, very critical is a series of experiences in laboratory research. Next slide. So, next slide, please. So it requires to have multiple summer projects, undergraduate research thesis, perhaps a postbac. The NIH offers a series of postbac. As indicated in the general chats, in general, you are putting more time on this. This is fully paid, but on the other side, you are not going to be doing the same type of salaries that private physicians do. But it is a career that has so many rewards because you are impacting the health of millions in your particular area of expertise. You need to be familiar with testing a hypothesis. Next slide. Next slide, please. It is a highly rigorous plan of studies, and it requires a strong academics. But one number doesn't define you. Look at the extent of the MCATs, of our applicants and GPAs from our applicants, but the matriculants, and this is the national pool of applicants and the national pool of matriculants, goes from an MCAT of 56 percentile all the way to an MCAT of 100%. Next slide. Now, you can find a lot of information in our websites. In particular, this is an example of the academic benchmarks of our applicants. We do holistic reviews. And for individuals who have GPAs, for example, from 3 up to 4, and you can see it in this website. The slides will be available for you to review. This is the outcome from the standpoint of an applicant. So every dot that is gray is it's an applicant. Every blue one means an individual who we invited for an interview, and in orange is an individual that we offer an acceptance. Next slide. So as I said, one number doesn't define you. Next slide, please. And you need to be passionate about what you do. But this is one of the reasons why we don't get as much burnout as individuals who are just physicians or just scientists or just doing one activity, is that your week, your month is going to have multiple experiences in the hospital. I've been hospital neurologist in, treating some patients with COVID too. But I have also been working in my research lab, trying to understand, for example, how these new challenges, some of the patients with COVID, for example, are having seizures. Why? What is the mechanism? Can we intervene and provide medications, drugs that alter the natural history of disease? In my particular area of expertise, I have worked with post-traumatic epilepsy, meaning after a head injury. Can you stop and prevent the development of epilepsy? Next slide. So how the process of application happens. It takes time. You need to be deliberate. You need to have a series of coursework that you need to have pre-medical curriculum. You do not necessarily have to have a science bachelor, but you need to have done the background, the courses, the activities, and have the opportunities in biomedical research. So in order to prepare an exceptional application, it takes time. If you Google my last name, Cavazos, and physician scientist, or MSTP, you're going to find a series of presentations that have information about how to prepare your application for our program, as well for all programs across the country. State of residency does not matter. What matters, obviously, because of the funding mechanisms that we have, is for individuals to be U.S. citizens and residents. They obviously have a much an easier time, as well as for DACA students. For individuals who are international, there are mechanisms, and the AAMC has a list. If you just Google AAMC MD PhD, you are going to find a series of resources available. Next slide, please. That list schools that consider international students like ours. So you end up doing laboratory research, imaging research, mechanistic research, translational research, clinical trials. You work with samples of human patients, but you're going to be equipped to become a leader as a physician scientist that are bridging science and clinical medicine. Next slide. It is very important to understand that these programs have a community. You are of MD, PhD students, and we go through this journey that is 7 to 9 years of length, followed then by residency. As I said, you are fully funded throughout this process. You have the first 2 years of medical school with some graduate school involved with there. You have then graduate school with a few sprinkles of research, of clinical rotations, where you are still taking care and keeping your hands wet of seeing patients. And you then do the clinical clerkships that are required to become a physician. Next slide. So that's the general timeline. Along this way, we have boot camps to get you transition, but it is a community, and we are looking for creativity, leadership potentials, but most important, thinking about the scientific method, biomedical research experience. Next slide. It is a community of people, and certainly it is important to know that activities that are happening outside right now, for example, our students participated very heavily in organizing this group for White Coats for Black Lives in our institution. Next slide, please. And our students then graduate and go to places. And next slide, as they go into different residencies, they tend to go to residencies that are heavily research-based. Their outcomes include 4.7 manuscripts, and our mean time to graduation is 7 to 9 years, with 7.97 students years, with 86% of our students have earned individual grants during their applications. So we have a series of competencies that we need to teach you, and among those competencies, we need to teach you about writing grants, writing papers. Next slide. These are the institutions that and some of the outcomes of where our students go. Next slide, please. And so they go and are represented all over the country. And the city is a great city to be. It's a Hispanic majority city. Next slide. And you can actually forward the next 3 slides. They are finishing so that we can wrap up our discussion. Next slide. And next slide. This is the last slide is the most important. There is a series of resources. As I said, if you look at MD PhD and my last name, you are going to find multiple resources to learn more about this pathway. And next slide. Next. There's only 2 slides left. Next. And if you also Google AAMC and MD PhD, there is a lot of resources. And this is my last slide. Please stop the slide set so that we can start with the questions and answers for the 3 participants. Thank you.
All right, thank you, Dr. Cavazos.
So
and Dr.
as promised, I did it in almost 15 minutes, but sorry.
Thank you, Dr. Cavazos and Dr. Hernandez. At this moment, we just have 10 minutes, but there are only 2 questions that I think Dr. Hernandez already answered about the master entry in nursing practice. She mentions that master entry is a wonderful option, and many schools offer this path, and that be sure to know what specialty you're earning. And then, Dr. Cavazos, there was a question for you. Is the stipend specific to UT Health, or is this something that MD, MPH programs offer across all medical schools?
It is pretty much most MD PhD programs across the nation will offer you a stipend that it's also city specific. So for example, if you're in New York City, it's going to be like $36,000. But in cities like San Antonio, $30,000 will go farther. But yes, the majority of programs will come with paying your tuition, stipend, and fees. And it is kind of a pro quo. We're expecting that you are going to be part of our national workforce of physician scientists and be, I mean, this is why the NIH provides funding for many of our programs.
Thank you, Dr. Hernandez. A few minutes of wisdom that you would like to offer our students before we end. We don't have any questions specifically right now, but if anything that you feel from that you want the students to know about the exciting nursing practice programs and what the nursing profession can offer.
Absolutely. Your field is limitless. With my PhD, I am also a nurse scientist. I do spend more of my time teaching. I teach at University of Incarnate Word, and I was at Clemson previously and at University of Illinois. And for me, I had to decide how much research and how much teaching I wanted to do. So I came to Incarnate Word because my love is the teaching and working with my students. So that's my balance. I do a little bit less research, more teaching. Other places it varies. Someone asked for my contact information. I can put it in the chat, or if you can write it down, it's CM Herna, HERNA 2 at uiwtx.edu. If you want to get in touch, I'm writing it in here now. I'd be happy to provide you more information. And the person who asked about the master's entry, be very careful, because the master's entry in nursing now it's a spectrum that's being created. Some programs create you to be an advanced generalist. So that master's degree is not going to allow you to be a nurse practitioner or one of those routes, if that's what you want your end game to be. There are others that will bring you in and do that. So it's going to be very school specific, because nursing is still sorting out some of the paths to your different educations. I don't know that it's as straightforward as Dr. Cavazos' path or what Dr. Balcazar was assigning it. So I'd be happy to entertain if anybody has individual.
There's one more. Do we need, for Dr. Cavazos, do we need publications to get into the MSTP?
No, actually, quite often, the majority of applicants do not have publications. Having said that, many of these applicants have done substantial against research experiences as a senior thesis, some amount of work in a research lab. I mean, we are providing you with essentially a scholarship of $500,000 to $1 million per student, because it's obviously spread out over 7 to 9 years with no repayment. And so we want to make sure that the applicant has had sufficient amount of time in the environment of research to understand that they really want to pursue this career.
Good. And as for all the students, as Dr. Hernandez was mentioning, that her path to nursing is very varied as well, because it provides the practice experience and the research experience. The same thing is with public health. Is you could be at the level of the master's, and if you wanted to really then work after completion of the master's, you can do so in many different areas, in the government, in the industry, with community settings, with projects. But then if you wanted to then begin to work more into research, then there is that opportunity that you could get a PhD in epidemiology, a PhD in health policy, so that you then begin to start crafting what Dr. Cavazos mentioned, that idea that you can get excited about science, and that science can give you that opportunity to really evolve into understanding of a particular problem. So there is a lot of variety. So knowledge is important for all of you to really get to know what exactly is what you really want. What exactly, how do you see yourself in the next few years? And that's probably what is important. Dr. Cavazos, Dr. Hernandez mentioned, again, that there are different pathways, different areas of expertise, and that it's up to you to think about it. How do you want to craft that intentionality that I mentioned to you as a scientist, as a PhD? Dr. Hernandez, Cavazos, any other? We have 5 minutes.
Your journey is going to be very unique. No matter where you end up, your journey is very unique, but you need to have reflection about the experiences that you have had and what is it that you like. And, you know, every aspect of human biology, every aspect of medicine requires people who have curiosity and intentionality. There is actually a question for you, Hector, regarding the public health.
Oh, actually, there's one. How does having written grant for a research project and receive a thing during undergraduate weigh on the application for the MD, PhD? That's the one I see.
So there was one for you that says, do we need to have a bachelor's in public health to get into an MPH program?
No, not necessarily. No, many don't have. Now, the exciting part is that many universities are building undergraduate programs, 4+1 programs that you can get into the master's programs when you start with the undergraduate in MPH, but in public health. But many areas you don't have to have an undergraduate in public health to get into the MPH program. And then for you, Dr. Cavazos, is how does having written a grant for a research project and receiving it during undergraduate weigh on the application for MD, PhD?
Absolutely. We're looking for individuals who are budding scientists. You know, being working in a research lab, you can work as a technician. We're not looking for technicians. We can hire technicians. What we're looking for is individuals who have that type of experience. So that, I mean, anyone who has written a research application, even if it is small, as an undergraduate student, have an edge, because that is the scientific process that we have. You need to put into a grant the scientific process. Find what is the big area, why this is important, what is the gap of knowledge, what is the hypothesis, develop an experimental design that answers that hypothesis, and what kind of expected information your grant is going to do. So definitely it's going to make you a better applicant, and certainly doing presentations at places like SACNAS, ABRICAMS, NHMA, and other activities that exist, presenting a poster. It makes you reflect and think. What is it that you are bringing to the table? And as I said, I mean, there's actually nurse PhDs, dental PhDs, PharmD PhDs. So there are dual degree programs across other health professions. We need health professionals with PhDs who are doing research in all of these areas. So there's not one single journey. There's multiple journeys, and you need to reflect what is it that you want to do and try to apply and seek those experiences.
Thank you. We are running out of time. We wouldn't be able to answer all the questions. The last one to say is, what about public health research? Can that apply to MD, MPH? Absolutely. So as Dr. Cavazos mentioned, all the opportunities that you get, it will be very helpful. Well, I'd like to thank you, Dr. Christina Hernandez, Dr. Cavazos, and to all the audiences and students, and to the HMA College of Health Programs at this pre-health conference for providing us that platform for guiding the students to bring that opportunity for youth for a health profession. So thanks very much, Benjamin, for all, and I wish all of you a good afternoon.
Thank you. Thank you.
Goodbye, everyone.
Bye, everyone.
Thank you to our. I want to say we have 1 minute until the next recruitment fair, as well as the mock interviews that we are hosting. But I do encourage all the students to stay until 6 p.m. Meet all of the recruiters. We are going to be sending out a survey on Tuesday, which will also include the link to watch the recording of the video, as well as the presentations as well. We invite you to stay the whole time. We will be raffling a few things like an NHMA mug, a drawstring bag that we usually give out in the beginning of the program, as well as a shirt. So with that, please, we'll go ahead and get back to the recruitment fair and the networking session. So thank you very much.